I really hate to burst the bubble of trust that most Americans have placed in health insurance companies for the past 90 years, but the last thing you are in the hands of a health insurance company is safe. You see, health insurance companies are not in the business to look out for your health or your finances. They're in the business to make money, not friends. That's why it's more important than ever for us everyday people to reclaim our rights and the power that we all have to be smart customers when it comes to our own health and healthcare. I'm here to pull back the curtain on the health insurance shenanigans and the dangerous conflict that they have with the very same people whose health they insure. My name is Art Getz with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare, and health benefits that can make your life better. Before I tell you the 3 reasons why you should hate your health insurance company too, I'm going to share with you how I came to know what I'm talking about. It all started in the fall of 2006 when I teamed up with a legendary ER physician named Victor Miranda. We had a contract to staff and manage all the ERs and trauma centers for a well-known hospital system. It quickly became painfully clear that the hospitals were crashing. They weren't set up to take in the volume of patients that were coming into the ER each night. This happened everywhere because big health insurance companies had lowered ER copays so low that patients were coming in for everything under the sun, not just emergencies. It was a nationwide problem, not just here in Texas. ERs and really sick patients were dealing with unthinkable and unsafe wait times. People were suffering and even dying as a result. It turns out that the long ER wait times were caused by a logjam in the hospital. You see, patients come to the ER when the hospital admitting staff is at home with their family or asleep. This left the sickest patients stacked up in the ER waiting rooms, with many more backed up in the overcrowded rooms. It stayed like that overnight until the admitting staff could process the discharges and make room to move the previous night's ER patients into the hospital beds. It was a managed crisis every single night with people's lives on the line. So we came up with the concept of a freestanding ER. The basic idea was to completely separate the ER from those forced constraints of being attached to a hospital. After we'd been seeing ER patients for almost a year, these very large health insurance companies just stopped paying our bills for the very patients that they were insuring. They even threatened to take legal action to shut us down. It didn't matter that this was one of the most sophisticated ERs in the nation, which was certified by the Joint Commission on Healthcare. Heck, we even had our own helipad. None of that mattered because they simply just stopped paying the claims. It was over 80% of our cash flow, and I didn't know what else to do. I could have hired a lawyer to fight them and get squashed like a bug. So instead, I took the fight to Austin, Texas, where I drafted, lobbied, and passed the nation's first ER licensing law in Texas. And since then, health insurance companies have been forced to play ball with freestanding ERs and pay the patient's bills. The best news of all is that ER wait times have come way down to under an hour in most places where they exist. This experience taught me an awful lot about the darker side of big health insurance. So I've got a deep understanding of the 3 reasons I'm just about to share with you about why you should hate your health insurance company too. Reason number 1, health insurance companies are designed to make a profit on the sickness of other people. Health insurance companies have done an amazing job of branding to make you think that you're in good hands with them. And insurance agents, of course, are going to send you friendly birthday cards and things like that because they want you to think they care too. But the one thing they're all interested in is making a profit. Let's be clear, we're talking about the most powerful, largest, profit-driven companies on the planet, and they're in control of healthcare spending for the majority of Americans. It's no big secret that healthcare in this country has been dominated by a handful of profit-minded insurance companies for a really long time. And what could possibly go wrong? The insurance business is really pretty simple. You take in more premiums than you spend on overhead and claims. What's left over? It's your profit. A long time ago, some really smart health insurance people realized that there's only 2 ways to make more money in the health insurance game. First, sell more insurance to more people. And secondly, increase the premiums every year if possible. They make a profit on every dollar they spend on healthcare by marking up last year's claims to determine how much to increase the premiums next year. They never lose money. When claims go up, they simply increase the premiums. Your health insurance company has zero incentive to pay less for health care. Think about it. That wouldn't be in the best interest of their shareholders. The uncomfortable truth is that the sicker you are, the more money they make. It's why legendary investor Warren Buffett calls health insurance companies a tapeworm on the American economy.
So medical costs are the tapeworm of American economic competitiveness. I mean, if you're really talking about it.
The insurance game is 100% stacked in their favor. Reason number 2, health insurance companies will stick it to you every chance they get. I learned in the ER that your health insurance company, they get to decide what's covered and what's not. It's true. In fact, most people don't even realize that your health insurance company can actually deny your ER bills if they disagree with your decision to go there. It goes like this. You or your employer pays the health insurance premiums like clockwork every year. You feel safe knowing you have a $250 copay if you have a medical emergency. It says so right on the back of the insurance card. But here's the big shocker. If you just pop over to the ER for what might be primary or urgent care, brace yourself for the big surprise. An unpaid ER bill. This happens to people all the time in the heat of a medical crisis, and you just don't know what else to do. You're not sure where to go. Even if you don't know what's going on until after seeing the doctor, that's just too bad if you picked the wrong place to go, because the insurance company, they get to decide after the fact. And so a few months later, they might notify you and the ER that your emergency was determined to be non-emergency. They deny the claim. And just like that, you're on the hook all the way up to your deductible for the ER bills. So you're doing the best that you can in the heat of a moment with a bad healthcare problem, and you go to the emergency room. But the health insurance company gets to be the armchair quarterback sitting in some distant office somewhere else and telling you after the fact, and then making you pay for the bills. Reason number 3. Health insurance companies are the most wasteful businesses in America. Health insurance companies don't provide care, they don't see or treat patients. All they do is act as a middleman to take money from you and pay it to the healthcare providers, all the while making sure that their executives get a big office and a big bonus. That's it. But the cost that they impose on other people in the form of premiums is shocking. The very first thing I learned in the ER is that you actually spend about 30 or 40 cents of every dollar just to collect the dollar. That's a whopping 40% on insurance-related costs, things like coding, billing, negotiating to collect your revenue from the insurance companies. These dollars provided zero health care, not a stitch or a pill was given out. In the freestanding emergency rooms, we were actually spending more money on insurance-related costs than we were paying doctors and nurses. It's enough to make your head explode. Can you imagine any other business that works like that? These 3 reasons are why we decided to start the Health Benefits Network. We're out to challenge the status quo and fix the broken healthcare system, one business, one family, and one individual at a time. We're here to challenge the outdated thinking that health insurance is the only path to affordable health and health care. We want to wake up the customer inside of every one of you. These days of just letting health insurance companies pick the doctors and determine the cost of care are coming to an ugly end. Even if you pay outrageously high health insurance premiums, it's no guarantee that you'll receive the care that your doctor is actually prescribing. And even then, only limited financial protection after you've paid a small fortune out of pocket for a deductible. I really see this as a David and Goliath effort, where the greedy giant is the big health insurance companies, and David, that's all of us who just can't take it anymore. I see this channel as our way of speaking up to share tangible ideas and actionable solutions for every business leader or family who's struggling with the affordability, availability, and access to quality health care. We want to hear from you, so please leave your questions and your thoughts in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefit news and stories. Don't forget, hit the like button and share this video with your colleagues and friends, because they have a health insurance problem too.